In this video, I will share and review a distinct type of renal cell carcinoma which used to be under-recognized just a few years ago. However, it is in fact quite easy to diagnose once you know the criteria and see some examples of it. It is beyond the scope of this short session to be a thorough review of this topic. Please keep in mind that our knowledge of renal cell carcinomas is evolving, and what we are talking about here may not be quite accurate 10 years down the road. So please note the publication date of this video. Okay, let's get started. We begin with reviewing this slide from a nephrectomy case. From low magnification, a renal tumor with clear cells is readily recognizable. So naturally, the first working diagnosis one would think of would be clear cell renal cell carcinoma or clear cell RCC. But wait, looking around, there are some areas with papillary architecture. This is where we start thinking of other diagnoses. What if this is a papillary renal cell carcinoma? Let's keep looking around. And here we go. Here are some packed tubules. Note that regardless of the architecture, the tumor cells are clear cells with low-grade nuclei. You may ask, then what is it that set this one apart from our usual clear cell RCC? Well, in fact, it's a combination of microscopic findings and immunoprofile of tumor cells. Microscopically, we will need clear cells to begin with. They should be low-grade, and this is important. And the nuclei are uniquely arranged in a linear fashion. This last bit is the one feature that will make you think of this entity at first glance. Once we have the microscopic features, doing immunostains will be the next step to confirm or rule out the diagnosis. Let's keep it simple. I like the following three stains in my practice: carbonic anhydrase 9 or CA9, cytokeratin 7 or CK7, and racemase or AMACR. These three form the essential panel required for diagnosis of clear cell tubulopapillary RCC. CA9 will be positive, but unlike clear cell RCC that's circumferential or box-shaped, it's basolateral or cup-shaped. I like the next one. CK7 is diffusely positive. Let's put it this way. It's unlikely for a clear cell RCC as low grade as this one we are looking at now to show diffuse positivity like this. Next one is AMACR. That's negative most of the time. This is in contrast to papillary RCC, in which we usually get diffuse positivity. We could consider two more stains in tricky cases. CD10, and it will be negative in most cases. High molecular cytokeratin, that's often positive. Once you have the constellation of microscopic features and immunostaining, the diagnosis of clear cell tubulopapillary RCC is established. To wrap it up, these tumors are not so uncommon, and the diagnosis is straightforward if you keep them in mind. You will need immunohistochemistry to support your diagnosis or impression. I like to keep it strict to avoid overcalling or miscalling other subtypes.